Most people picture a heart attack as a sudden event. A man grabs his chest, collapses, someone calls an ambulance. That is what the movies taught us. That is what most people expect. But after 20 years of operating on hearts, holding them in my hands, repairing damage that took years to build, I can tell you something the movies never show. A heart attack does not just happen. It builds slowly, quietly, over weeks, and your body tries to warn you almost every single time. Not with dramatic chest pain, not with a Hollywood collapse, with small, strange, easy to dismiss signals that most people brush off as stress, aging, or nothing at all. That is the part that keeps me up at night, because by the time someone reaches my operating table, I already know the truth. Their body gave them the warning. They just did not know what to listen for. I am Dr. Maya Okafor. I am a cardiothoracic surgeon. And this is the conversation I wish I could have with every single person over 50 before they ever need to meet someone like me. 7 warning signs your body sends, sometimes a full month before a heart attack. Signs that most doctors do not have time to explain in a 15-minute appointment. Signs that could give you the one thing a heart attack tries to take away: time. Before we get into the 7 signs, I need you to understand what is actually happening inside your body in the weeks before a cardiac event. Because once you understand the mechanics, the warning signs stop sounding random and start making perfect sense. Your heart is a muscle. It needs a constant supply of oxygen-rich blood to function. That blood arrives through your coronary arteries. Now, when one of those arteries is slowly narrowing, either from plaque buildup or inflammation or both, the heart does not just quietly accept it. It starts sending distress signals to the rest of the body, not all at once, gradually, through pathways most people would never connect to their heart. That is why these signs feel so unrelated. Jaw pain, stomach trouble, exhaustion. They seem like separate problems. They are not. They are one problem expressing itself in 7 different ways. And after 60, your body has less reserve to compensate, which means these signals often show up earlier and more clearly if you know what you're looking at. Let us start with the one that surprises nearly every patient I have ever spoken to. Sign number 1, unusual, persistent fatigue that sleep does not fix. I am not talking about being tired after a long day. Every human being gets tired. I am talking about a specific kind of exhaustion that settles into your body like wet concrete and does not lift no matter how much rest you get. You sleep 8 hours and wake up feeling like you ran a marathon in your sleep. You sit down to read the newspaper and your body feels heavy, drained, like someone pulled the plug. This kind of fatigue is one of the earliest and most commonly missed warning signs of an approaching heart attack, especially in women. Here is why it happens. When your coronary arteries are narrowing, your heart has to work harder to push blood through a tighter space. It is like trying to water your garden through a hose that someone is stepping on. The water still flows, but everything has to work overtime. That extra effort drains your energy reserves even while you are doing nothing strenuous. Your body is burning fuel just to keep up with basic circulation. And here is what makes this so dangerous. Most people over 60 hear this symptom and think it is just aging. Their doctor might think so too. You are 72. Of course you are tired. That sentence has cost people their lives. If your fatigue has changed recently, if it came on over the last few weeks and does not match your activity level, do not dismiss it. Mention it specifically. Sign number 2, shortness of breath during activities that never bothered you before. You used to walk up a flight of stairs without thinking about it. Now you reach the top and you are breathing like you just sprinted. You used to carry groceries from the car in one trip. Now you need to stop and catch your breath halfway. This is not about being out of shape. This is about your heart struggling to deliver enough oxygenated blood to your muscles and lungs when demand increases. When the arteries feeding your heart are partially blocked, your heart cannot increase its output the way it used to. So when your body needs more oxygen, during climbing stairs, walking uphill, even having an animated conversation, the supply cannot meet the demand. Your lungs try to compensate by working harder. You feel it as breathlessness. The critical detail here is the word change. If you have always gotten a little winded on stairs, that may be your normal. But if something that was easy 3 weeks ago now leaves you gasping, that is your body telling you the supply line is compromised. Pay attention to the timeline. When did this start? Has it been getting worse? Those details matter enormously when you sit down with your doctor. Sign number 3, a strange discomfort in your jaw, neck, or throat. This is the one that catches people completely off guard because nobody associates jaw pain with their heart. Most people assume it is a dental problem, an ear infection, maybe tension from stress. And sometimes it is exactly that. But when jaw or neck discomfort appears without an obvious cause and comes and goes over several days or weeks, particularly during physical effort or emotional stress, it can be referred pain from a heart under strain. Here is the mechanism. Your heart does not have the same pain receptors as your skin. When the heart muscle is distressed, it sends pain signals through shared nerve pathways. Those pathways also serve the jaw, the neck, the throat, the left shoulder, and the upper back. Your brain receives the signal but misreads the location. You feel it in your jaw. The problem is in your chest. Women are especially likely to experience this pattern. Multiple studies have confirmed that women presenting with heart attacks are significantly more likely than men to report jaw pain, neck discomfort, and upper back pain rather than classic chest pressure. And because these symptoms do not fit the Hollywood picture of a heart attack, they get ignored, sometimes by patients, sometimes by doctors. If you have unexplained jaw or neck discomfort that has been recurring over the last few weeks, and you cannot connect it to anything obvious, bring it up. Do not let anyone dismiss it without at least checking. Sign number 4, digestive problems that appeared out of nowhere. Nausea, bloating, a feeling of fullness even when you have barely eaten. Occasional heartburn that does not respond to antacids the way it used to. These symptoms are so common in everyday life that most people never think twice about them. And that is precisely why they are so dangerous as heart warning signs. They hide in plain sight. When the heart is struggling, blood flow gets redirected to the most critical organs. Your digestive system is not at the top of that priority list. Reduced blood flow to the gut causes exactly these symptoms: nausea, indigestion, discomfort that feels like a stomach problem but is actually a circulation problem. I have had patients tell me they spent 2 weeks treating what they thought was a stomach bug before ending up in my operating room. 2 weeks of warning signs disguised as something ordinary. The key distinction is this: if you have a sensitive stomach and these symptoms are familiar and long-standing, that is your history. But if these digestive complaints are new, appeared in the last few weeks, and you cannot explain them with a change in diet or a known illness, they deserve a closer look, especially if they show up alongside any of the other signs on this list. Sign number 5, cold sweats and dizziness that come without explanation. You are sitting in your living room. The temperature is comfortable. You are not anxious. And suddenly, your skin is clammy. A wave of dizziness passes over you. It lasts a few seconds, maybe a minute. Then it is gone. You shake it off. Probably nothing. But it is not nothing. Cold sweats and sudden dizziness in the absence of an obvious trigger are your autonomic nervous system firing an alarm. When the heart is under significant stress, the body activates its fight or flight response even when there is no external threat. Adrenaline and cortisol surge. Blood pressure fluctuates. You sweat without heat. You feel lightheaded without standing up too fast. After 60, this symptom carries extra weight because the cardiovascular system already has less reserve. The margin between compensation and crisis is thinner. A sudden cold sweat that hits you while you are resting is not something to mention casually at your next appointment in 3 months. It is something to mention this week. Sign number 6, a feeling of pressure, tightness, or heaviness in the chest that is not quite pain. This one sounds like it should be obvious. Chest discomfort equals heart problem. But the reason people miss it is because they are waiting for pain. Sharp, stabbing, unmistakable pain. What they get instead is something much more subtle, a feeling of tightness, like someone is sitting on your chest, a heaviness that comes during exertion and fades with rest, a squeezing sensation that lasts a few minutes and then disappears completely. This is called angina, and it is one of the most direct warning signs that your coronary arteries are not delivering enough blood to your heart muscle. The heart is temporarily starving for oxygen. When you rest, demand drops, supply catches up, and the sensation fades. That cycle of discomfort during effort and relief during rest is a textbook cardiac pattern. But here is what I have seen over and over again in my career. People experience this and rationalize it. They call it muscle strain. They blame it on acid reflux. They tell themselves it went away, so it must be fine. It went away because you stopped moving. That is not fine. That is a warning. If you feel chest tightness or pressure that comes with exertion and leaves with rest, especially if this pattern has developed recently, you need to see your doctor. Not next month, this week. That window of time between the first episode of angina and a full heart attack is the window where everything can still be prevented. Do not waste it. Sign number 7, a sudden, unexplained sense of anxiety or dread. This is the one that sounds the least medical, the least scientific. And yet I have heard it described by enough patients that I cannot ignore it. A feeling that something is wrong, not emotionally wrong, physically wrong. A sense of dread that does not attach to anything specific. No bad news, no stressful event, just a deep, persistent feeling that your body is in trouble. There is real physiology behind this. When the heart is under strain, it affects the vagus nerve, which connects the heart directly to the brain. Disruptions in cardiac function can trigger anxiety-like responses that have nothing to do with your mental state and everything to do with your cardiovascular system sending distress signals to. Your brain. I have had patients tell me they felt a sense of doom for days before their cardiac event. They could not explain it. They felt embarrassed mentioning it. Some never mentioned it at all until after the surgery, when I asked them to think back over the weeks before. And then they said yes. Yes, I felt something. I just did not think anyone would take it seriously. I am taking it seriously right now. If you feel an unexplained, persistent sense that something is physically wrong and it does not go away, listen to that feeling. Your body is trying to tell you something that your conscious mind has not figured out yet. Now, here is what I need you to do with all of this, because information sitting in your head without action is just worry, and worry is not what I am here to give you. First, know your baseline. You need to understand what is normal for your body so that you can recognize when something changes. How many flights of stairs can you climb comfortably? How far can you walk without stopping? How do you feel when you wake up in the morning? These are your reference points. When they change without explanation, that is your signal. Second, do not wait for all 7 signs. One persistent, unexplained symptom from this list is enough to have a conversation with your doctor. You do not need to check every box. A heart attack does not follow a checklist. Sometimes the body only sends 1 or 2 warnings. That is enough. Third, and this is the part that most people struggle with, do not let anyone tell you it is just your age. Aging is real. The body does slow down, but a sudden change in your energy, your breathing, your comfort level, that is not aging. That is a signal. And the difference between those 2 things can be the difference between catching a problem early and ending up on an operating table. Fourth, write it down. Every symptom, when it started, how often it happens, what makes it better or worse. When you walk into that appointment with a written record, your doctor has something concrete to work with. It changes the conversation completely. It takes you from, I have been feeling a little off, to here is exactly what has been happening for the last 3 weeks. That specificity saves time and it saves lives. I want to be honest with you about something. After 20 years in the operating room, there is one moment that stays with me more than any other. It is not the dramatic saves. It is not the impossible surgeries that somehow worked. It is the quiet conversations afterward. The ones where a patient looks at me from the hospital bed and says, I felt something weeks ago, but I did not think it was serious. That sentence. I have heard it hundreds of times, and every single time it hits me the same way. Because by the time they are saying it to me, we are already past the point where prevention was an option. We are in the territory of damage control, surgery, recovery, months of rebuilding what could have been preserved. Your body is talking to you. It has been talking to you your entire life. After 60, the volume goes up because the stakes go up. The margin gets smaller. The reserve gets thinner. And the signals your heart sends when it is in trouble become more urgent. 7 signs. Fatigue that sleep cannot fix. Breathlessness during easy activity. Jaw or neck discomfort with no clear cause. New digestive problems that do not make sense. Cold sweats and dizziness from nowhere. Chest tightness that comes with effort and leaves with rest. And an unexplained feeling that something is wrong. You do not need to memorize all 7. You need to remember one principle. If your body is doing something new, something unexplained, something that does not match your normal, pay attention, write it down, bring it up, push for an answer. The heart you are living with right now has beaten for you every second of every day without ever asking you for anything. It carried you through decades of work, stress, joy, grief, and everything in between. It did all of that quietly, faithfully, without complaint. When it finally asks you for help, it will not shout, it will whisper. And the only question that matters is whether you are listening. I am Dr. Maya Okafor. Take care of your heart. It has been taking care of you longer than anything else in your life. And please, everything I have shared today is general medical information based on current research and my clinical experience. Your situation is unique. Before making any changes to your care, talk to your own doctor who knows your full medical history. That conversation is always worth having.